post-menarcheal girl who was cancer diagnosis is scleronodular Hodgkin's disease, stage 2 BB.
Okay. I can request Dr. Bagal sir to give your insight in this case.
Yes. So again, a young person with a diagnosis of Hodgkin disease and stage 2B. And as I discussed earlier, first my goal would be to see what is her treatment required and what is her prognosis with that, and obviously the risk of infertility with that. So this
Yes.
girl just 15 years of old, and she has a stage 2B disease, and she'll probably be treated with chemotherapy only backbone, like 6 cycles of ABVD. And this probably looking at different drugs and the treatment outcome, this puts her at the low risk of infertility because of the treatment per se. But having
Okay.
said that, certain fraction of patient even in this early stage disease might fail and will require subsequent salvage treatment, and also very rarely stem cell transplant. So that is also have to be kept in mind. So definitely for such young patient, I would explain them the small but definitive chance of having infertility because of the treatment, and I will refer them for a counseling and if feasible, some preservation of oocytes.
Okay, sir. So, can I request Dr. Chaitra to give insight on this about the what fertility preservation options to this young girl?
Thank you, Snehal. Important for this young girl is, we have to discuss with her both from the treatment perspective and also from her psychological perspective.
Sorry, your voice is not clear.
Any child
Yeah.
who's just 50, she'll be very confused when you go and, okay, yeah, is
Yeah.
it better?
Yeah,
Yeah,
it's better. Yeah.
okay. A 15-year-old child who has just started her periods, just understood that she's become a older adult, on the verge of being an adult. When you go and talk to her about fertility and do you want to become a mother and all those options may be confusing. So important would be to have a team approach, as has been emphasized together. Ideally, a pediatric nurse or a counselor would be the person to go ahead. And one more important thing is there's something called as the ovarian reserve, the number of eggs that a girl or a woman would have, and what are the chances of having a good prognosis. In a 15-year-old, an AMH would not be the best option.
Yes.
Because AMH would be better off from 22 years onwards. And also, antral follicle count would be difficult because
Yes.
ideally this girl would not be sexually active. So maybe a transabdominal scan, and if the oncology team agrees, we'll have to counsel her, or rather the parents, that probably there could not be any challenges with her fertility. And if there is time, ideally, yes, we could think of doing probably some cortical preservation,
Yeah.
or oocyte preservation, depending on what would be the best option.
Yes. Yeah, that is very important. Thank you so much. And definitely, with this, we will just discuss on this part. What are the challenges in dealing with basically pediatric cancer population? This is very important. These challenges with respect to the ethical, legal issues as well as the counseling. So, I can request Dr. Anjali to speak on this.
Yeah, thank you, Dr. Snehal, for having me here. And
Yeah,
as we
thank
have
you.
already said, that fertility preservation is no longer just an idea; it is actually a medical specialty in its own. Definitely, young pediatric group of patients like those who are just pubertal or pre-pubertal, discussing these kind of things, they really need age appropriate counseling.
Yes.
And yes, we need to involve the pediatric counselor, we need to involve their parents. And because when these kids will they'll grow up, and if they had to face infertility, then when these were asked that if you would have been offered these any fertility preservation techniques earlier, then they said that yes, they would have accepted that. So
Yes.
definitely, although it's just the beginning, but yes, these group of patients, they definitely needs counseling, and this counseling will be difficult because still we don't have any guidelines and we don't have any, appropriate persons for these counseling sessions. And yes, we need a appropriate environment. We need to give them psychological support, emotional support, and obviously, since these are pre-pubertal children, pre-pubertal group of patients, all the techniques which are there, like ovarian tissue cryopreservation, they are still, experimental, and they are in their experimental stages. So we have to, enroll them for these techniques, and we have to take permission from the review board
Yes.
if we are doing such techniques in these group of patients.
Yes,
So
yes.
that's all.
Yeah, that is very true. Thank you for nicely describing. Also, I'll mention about, yes, informed consent from the parents is very important, as well as we have to, with the age appropriate counseling, the child also has to be involved on this depending upon the level of development and the maturity, and it is something called assent of the child, that is also important. And also here there are certain, as you rightly described, certain situations where we need a clinical ethics review. So we'll skip this. So this is a workflow basically for the pediatric population. So mainly in this, the most important focus is involve the team, counseling, then counseling of the child as well as the parent, involvement of the both, and proper documentations and the consents, and definitely the different options. So these are the challenges basically.